Good evening, ladies and gentlemen. My name is Ehsan Muallim, and tonight I'm going to talk about spirituality. The focus of this talk would be on reincarnation. This is part 4 of the lecture series, and in the first 3 parts I talked about generally about consciousness, near-death experiences, and a little bit about mediumship. Let me go ahead and get started first by defining the terms I want to use. When I talk about spirituality, I assume that an entity called spirit exists that is a consciousness other than biological sensory system. In other words, when I'm talking about spirituality in this context, I'm not talking about necessarily the religious context of it, the religious aspects of it. I'm not also talking about a relaxation of my body. What I am referring to is just spirituality as existence of an entity which continue to exist independent of physical body, or it can survive after physical bodily death. But how much evidence do we have to support our assumption? If you search on internet about spirituality, you might come across several websites. Aside from the religious website that you might come across, there are several websites about spirituality that tells you something like life is beautiful, you are a spiritual being, you're awesome, you have eternal life, live at the moment. However, and all these similar generic statements. However, none of these statements provide any scientific evidence for the theory of spirituality or for the theory of continuation of consciousness independent of physical body, or continuation of consciousness beyond the moment of physical death. Even if they agree all of these statements are true, still they don't provide any evidence. So, in this field, we should consider how much evidence do we have, how much data we can collect to support our hypothesis, to support basically, or shows actually that the consciousness continues to exist beyond the moment of physical death. In the first 3 parts of this lecture, I presented some data that suggested the consciousness continues beyond the moment of physical death. I presented my data basically under 4 lines of evidence. If we want to rely only on experiments, we have first near-death experience cases in which a patient or an individual that has been unconscious for some time comes back and tells us that not only he has been conscious, but he or she has been aware of all the events and anything that has happened around them. Sometimes these events, these awareness or these consciousness happens during the time that the patient has been under close medical observation. They have been in surgery room. In several cases, the patient has recorded to have no heartbeat, and in a couple of rare cases, the patient, according to electroencephalograph or EEG, shows no electrical brain activity. I have talked about these cases in the first and second part of my lecture, so I don't get into details of them. The second line of evidence that we can have to support this theory, this aspect of theory of spirituality, which existence of consciousness beyond the moment of physical death, are mediumship cases. There are cases in which mediums apparently can communicate with the deceased person, and they come across, or they come by some information that is not available to the medium. The only possibility is the medium has been able to communicate with the deceased person. For example, it has been personal data or personal information of the deceased person that nobody has access to. Again, I talked about a little bit about this line of evidence in my third part of this lecture, so again, I don't elaborate on this today. Today, or tonight, we want to focus on the third part and fourth part of these lines of evidence. That the third part that I want to focus tonight is past life regression, which mostly contains hypnotherapy. When we say past life regression, probably most of you are familiar with, but it's just patients who, under hypnosis, who can remember glimpses of their past life. And when we consider these past life regression cases as evidence, I don't mean all the past life regression cases can be accounted as evidence for supporting the theory of continuation of consciousness. There are cases that patients remember, or the subject remembers, living 200 years ago, 1,000 years ago, but we don't have any way to verify those information. So those, in my opinion, cannot be accounted as a scientific evidence. Only the cases that the subject brings a piece of information from the session, the hypnosis session, that can be verified if we do the research, can be verified that yes, it has happened at that time, and the subject has not have access to the information, then we can say that something paranormal is going on, and these cases of past life regression can be accounted as a supportive evidence for the theory of continuation of consciousness after physical death. And we can assume that probably the patient or the subject has lived that past life. We will talk about it in a second in more detail. The fourth line of evidence that I want to talk about tonight is xenoglossy, birthmarks, and children who remember past lives. These are different from the previous line of evidence, which needs hypnotherapy. Especially the children who remember in past life, the cases that have been documented, the number of cases are huge, and more than 2,000 cases up to now has been well documented. And xenoglossy or xenoglossy is the ability to speak a language the subject has never learned or never has been extensively exposed to. So when we come across these cases, the only reasonable explanation is probably the subject has lived that past life. But we should get into the details of the case to see how convincing each case is. So, as you might have noticed, what we want to talk about tonight, part 3 and part 4 of these evidences, do not only support the theory of continuation of consciousness after physical death, but also they support the theory of reincarnation. So they suggest that we as eternal beings live in different bodies. Now, I have been a skeptic like most of you. I still am. I believe in this field we have to stay only with evidence and no more. Faith is good, but I don't take that approach here. If you have faith in afterlife, perfect, nice. But I don't take that approach here. I would like to take you with me tonight to take a look at some data that we have. I only present the evidence here. Whether you find it convincing or not, it is your decision, it's your right, I respect that. I only present the evidence to you. I only present the evidence here basically and leave the decision to you. If you ask my personal opinion, which of insignificant scientific value, I will say it convinced me, but you have to decide for your own. Have in mind that the sources I'm going to present tonight are totally independent. They are not from one university or one institute or one school of thought or one organization. The researchers have independently corroborated the data. In my opinion, it shows that the data can be reproduced and replicated. Now, since I don't consider myself an expert in this field, I will remain silent for the most part of this presentation. In my opinion, in any area of science, the people, the experts in the field can give technical opinion. These are mostly people who have performed experiments, who have spent a few years of their life researching the phenomena. Therefore, I would rather you listen to the entire lecture or interview, to the original lecture interview that the person has talked about his own experiments he has performed, rather than I reported in an inaccurate or maybe even distorted way. Now, I have to remind you that most of these cases do not have a nice comprehensive video so that I show them to you. They are mostly books, articles and papers and reports. I'll cite some references here though. However, I have to remind you that most of these cases do not have this video so that I can show them to you. What I can show you tonight is only the cases that have some documentary or have a video so that we can look into them together. However, they are not the strongest cases, but they are a good representative of the examples that you are expecting to find in this field. They are just basically excerpt of what we have in the pool of data. If you are interested, you are encouraged to spend a couple of years like me studying the details of that in books and articles and papers and case reports and testimony of witnesses. So what I'm saying is, this is just an introduction. The story doesn't finish tonight with this presentation. It just begins. I mean, your search just begins. Or our search just begins. First, I'm going to present 2 interviews and 1 documentary to you. This will take about 1 hour and 30 minutes. And then we'll have a 10-minute break, and then we'll come back for listening to the rest of interviews and case reports. The first part is a 30-minute phone interview with Dr. Brian L. Weiss, psychiatrist and former associate professor of psychiatry at University of Miami. He talks about his experiences with his clients who remember past life memories. We'll listen to this phone interview and we'll continue.
That's exactly the kind of person we're going to talk to tonight. As a traditional psychotherapist, Dr. Brian Weiss was astonished and skeptical when one of his patients began to recall past life traumas that seemed to hold the key to her recurring nightmares and anxiety attacks, ostensibly the reason for her being there. His skepticism was eroded, however, when she began to channel messages from the space between lives, which contained remarkable revelations about Dr. Weiss's family and his own dead son. Using past life therapy, he was able to cure the patient and then embark on a new, more meaningful phase of his own career. Dr. Weiss is the author of several top-selling books based on his experience as a psychiatrist and healer. A graduate of Columbia University and Yale Medical School, Dr. Weiss is chairman emeritus of psychiatry at the Mount Sinai Medical Center in Miami, and he maintains a private practice in Miami. In addition, Dr. Weiss conducts national and international seminars and experiential workshops, as well as training programs for professionals. In a moment, Dr. Weiss. We have, I guess in the world, certainly in America, we have a lot of mental illness, and America doesn't have much of a system for handling mental illness. It seems like there must be, a better way? And in your profession, I'm sure that you've given this a lot of thought. The mental health system in the U.S. seems to be a disaster. Do you have any thoughts on that?
Well, I agree with you. It's really done not in a compassionate way. And it's relied too much now on medication. Everything is turned towards that. As a matter of fact, many of the younger psychiatrists are very dissatisfied because a lot of them went into the field looking to talk with patients, to get to understand them, to help them, to relate at a deeper level. And now they're reduced to just handing out medications all the time without really getting to know them because they won't get reimbursed if they spend more than 10 or 15 minutes with a patient. So it really is in a state of disarray. It needs to change. It's not good for the doctors either.
Doctor, is there any way of your knowing whether mental illness is becoming a larger problem in America in terms of the numbers afflicted, or is it stable at a certain percentage of the population? Any thoughts?
Well, it really depends what illnesses we're speaking about. Probably schizophrenia is relatively stable, although I think some people have been overdiagnosed. But the incidence of stress-related diseases, depression, anxiety, panic attacks, post-traumatic stress disorder, these are going up because the world is getting to be so much more stressful, and we've lost a lot of our support systems. So when you have to really break it down by illness.
The numbers of bipolar people, for example.
That seems to be going up. I think for a couple of reasons. One, it's better recognized now. It's diagnosed more often. Before, people used to be just shuttled off to addicts. You know, the top story, I don't mean drug addicts, but addicts in the house.
I understand.
It would be hidden there. People would be lost in asylums. And so what's happening now is diagnostic skills have gotten better for that. But on the other hand, the pharmaceutical companies are so powerful and they make so many drugs for specific illnesses that these are probably getting overdiagnosed because the therapists think, well, now I have a treatment for it.
How effective are they, these drugs?
Some of them are. I mean, there's no question about it. For bipolar, lithium has been around for a long time, and some of the anticonvulsants are used now. But to just use the medicine without the talking therapy, without the increase of understanding that could come through that, I think is not good. It's got to be both in that case.
I guess that's sort of an ongoing almost war between traditional physicians and drug companies and psychiatry in general, huh?
It is. It's a very difficult situation for psychiatrists because they're kind of caught in the middle. And if they're intelligent, they usually get dissatisfied. They're not able to really relate and talk to their patients at a deeper level. The pharmaceutical companies are only interested in the drugs, and the government is interested in whatever's cheapest, which has nothing to do with necessarily the health of the patient.
So there we are. All right. Well, I guess I can't imagine what it would be like to be trying to help out a patient, and for this I'd like to take you back to how this began for you, because I guess that's where an interview like this should begin. I mean, to me, it would be astounding to be treating somebody for, I don't know, some anxiety they have or whatever, and to bump into something completely unrecognizable in the middle of hypnotherapy or some such. Is that, I mean, how did it happen? Lay it out.
It's kind of like you're saying, Art. I did not believe in past lives, and neither did the patient, who was a young woman in her late 20s, Catholic woman. And yet, when we were doing regression through hypnosis to go back to her childhood, to look for traumas that I felt might be causing her symptoms in the current time, she, under hypnosis, started to remember a lifetime about 4,000 years ago. Now, I didn't believe in this, and yet it was shocking because it was so vivid and so emotional and so detailed for her. She was seeing this visually, recalling herself in a different body, different name, drowning in a flood or tidal wave at the end of that life, somewhere in the Near East or the Eastern Mediterranean.
Doctor, do you recall what tripped this? In other words, as you were cruising along in whatever modality be in at that time? I mean, something must have tripped this.
Absolutely. What happened was that the first time that we did this, she remembered some childhood traumas, but her symptoms remained severe. So the next week when she was in, I asked her to go back to the time when her symptoms first began, thinking she'd go back younger in childhood. But that statement, go back to the time when your symptoms first began, that was the trip. That her subconscious mind taking that literally.
Got you.
That's when it went back 4,000 years, because one of her symptoms was a fear of gagging or choking, and also a fear of water. And that's what her mind chose to focus upon. So when she drowned in that ancient lifetime, that caused the fear of gagging or choking because it disappeared after she had the memory. And so that was the key.
Huh.
That is
so she just followed the instruction, and since the primary cause of her current problem wasn't in this lifetime, away she went.
Exactly.
And how much? I mean, how strongly did you realize that you had moved from something that happened in her life to something that had happened in another life, and how do you go about exploring that once you're there?
Well, I remember this vividly, even though it was, for me, 24 years ago, and more than 4,000 patients ago. But Catherine, the woman we're talking about, the woman from Many Lives, Many Masters, she was the first. So I remember being shocked, but also not believing it. I thought, this has got to be imagination or metaphor or fantasy. But why so vivid? Why so detailed? Why so much emotion, which we call catharsis, reacting with such emotion with the memory?
Right.
And why was she getting better? Because imagination doesn't do this. So it kind of came upon me almost gradually. There was a part of me that didn't believe it, and another part of me that knew that it didn't fit. It just didn't fit with imagination.
Well, as a matter of curiosity, you said Catherine, the one we're talking about, is 4,000 patients ago.
Yes.
How often during a hypnotherapy session do you run into something like this? I mean, there are many psychiatrists across America, that many of them do hypnosis. You would think that this might even be common if all we're talking about is common. And so you would think many psychiatrists would run into this or bump into this. Do they? And why don't they notice?
More and more are. And I do trainings now. I train 100 to 200 therapists from all over the world every year now. But actually hypnosis, which is only a form of focusing the concentration, it's very safe. And we get hypnotized every day when you're watching a movie and you don't hear the person munching popcorn next to you because you're concentrating in the movie.
Right.
That's what hypnosis is. That's a light state. Or reading a good book and you don't hear traffic noises. That's hypnosis. So it's very safe. But most psychiatrists don't practice hypnosis. Most therapists haven't been. Hypnotherapists have been doing it more for smoking cessation or weight loss.
Right.
So they would just be reading a script. And they weren't asking these open-ended questions like, go back to the time when your symptoms first began, or let's go back into a past life, because it wasn't in their belief system. And so actually it was happening, but not as commonly as you might think. And then when it did happen, the psychiatrist or the psychotherapist, because many of these are not psychiatrists, would be afraid to talk about it because they didn't want to be considered weird or strange, and were very concerned about the professional reaction. So they didn't tell anyone, and they certainly didn't write about it.
Well, isn't that understandable? I
Yeah.
mean, you've been at it for a while now and published on this. How's the reaction been?
Well, it took me 5 years to write Many Lives, Many Masters because I was concerned about that. Here I was chairman of the psychiatry department.
Yes.
I was professor of psychiatry at the University of Miami.
Yes.
This was very risky. So then I wrote it. I kept getting pushed to write it in a sense. It was helping my patients with grief. They were finding out about death and what happens after death and the space in between lifetimes. And so immediately there was a lot of support from individual therapists and doctors, also cardiologists and emergency room doctors and oncologists. Those who were dealing with death and dying had seen lots of these strange occurrences. But from the professional organizations like the American Psychiatric Association, there was a lot of negative feedback, and there was even a move to censure me, possibly to bring me up before the licensing board.
Oh.
But that never got anywhere, but just kind of deteriorated into chaos because I had been training many of the psychiatrists in Miami, and in psychopharmacology, that was one area of interest and work for me.
Well, as you know, we've recently lost Professor Mack.
Yes.
And what he went through sounds an awful lot like what you almost went through.
It was kind of like what John went through a little bit. I did a workshop with him in Boston some years ago because when he was regressing people to their abduction experiences, they were often remembering their past lives. So he called me up and said, Brian, I'm validating your work. And I would like you to do a conference with me up here in Boston. And so we did, and I was so sad to hear about his accident and his death.
Yes. So he did, though. He picked up the phone and told you that he was validating your work through exploration of abductions, alleged abductions, and bumping into past lives.
Yes, many of his patients were recalling past lives while he was doing his research, while he was regressing them to their abduction experience. And then he got in touch with me, and we shared our data, and he was very confirming. He had a harder time than I did, I think, because I was able to go before boards and tell them, look, patients are getting better, whether you believe in it or not. Maybe you can consider this past life thing Jungian, metaphoric. I don't, because I've seen so much. But if you want to consider it that way, that's fine with me. But patients are getting better. It's very safe. It's very effective.
Maybe that's the reason it all went sliding by.
I think so.
Because it was effective no matter what you might think it was versus what they thought.
Exactly. It really works. It's kind of like psychoanalysis. You go back with the patient. They're in a very relaxed state, except the arena is expanded. So instead of stopping at infancy or birth, we go back into in utero experiences and into past lives. And of course, in addition to being healing, now there's so many validated cases that it was very hard for the psychiatric boards to refute the clinical improvement and also the validation cases. Yes. So they just let it go to the side.
Doctor, if you were to take 100 people off the street, have permission to attempt to look for past lives, how many would you guess would be successful?
Well, when I do these big workshops, and not even one at a time, but all together, because hypnosis can be done with the eyes closed, and they're listening to my voice, about 2/3 will have a past life experience the first time.
Oh.
And if we did it more often, then it would get up to around 80%.
That's a lot.
That's a lot.
That's a whole lot.
Exactly.
So I guess if I were pursuing this and what had happened to you had happened to me, I would begin looking for what all scientists would, and that would be proof, some sort of proof of the things that were being said, some historical research or something that would prove what these people were saying was true.
Of course, I look for that too, and usually the patient is tracking it down, and there's some incredible validation cases. And yet there was the other avenue that I was also exploring, and that was the therapeutic benefits, the healing, the people getting rid of symptoms.
Of course.
So they were both going on at the same time.
Well, I'm sure that would be your primary job. Secondary, in researching all of this and trying to prove it so that you could write about it, it'd be very helpful to run into proof.
Oh, exactly. And there's some cases, such as the case of Jenny Cakell, the British woman who found her past life children, because many of the people have reincarnated. Now I'm going to talk as if I believe in it, because I do. After 25 years of doing this, I've seen so much that I really do. But I understand that listeners may not yet. And of course, there's as you try it, as you experience it, you learn so much more. But Jenny, along with several other people, have found their children from past lives. So many have found their graves or records of their lives that they're recalling under hypnosis. Many people have been able to speak foreign languages that they've never learned, this ability called Xenoglossy. And I can tell you in more detail some of these cases, but they're just amazing.
Yes, I would be very interested in that. I mean, I struggle with the whole life after death thing. I think like everybody else. We had a caller in the first hour who mentioned reincarnation and said, look, it was in, or is in the Bible, and to a much greater degree used to be in the Bible, but was kind of yanked out.
Yes, I heard him, and I heard the question.
You did? Wonderful. I think I'm much like many of you in that I really want to believe in an afterlife. After all, I'll be 60 years old in June, so I'm facing the prospect of my own mortality. So everybody doing that would want to believe in an afterlife. On the other hand, there is a pragmatic side of me that says, no, wait a minute, we don't really have any proof. And yet Dr. Weiss, a very learned man, just before the break, said he now believes in reincarnation. And that belief that's a very strong thing to say. You've obviously been convinced by what's happened to you, and I would very much be interested in some specifics, Doctor, the things that convinced you. Maybe they'll convince me, too.
Well, let me tell you two stories, then, two case histories. One is a woman I saw from China, a surgeon trained in Western medicine. This was her first trip out of China. She came with an interpreter to my office in Miami. And we did a past life regression. She couldn't even say hello in English. Couldn't speak any English at all.
That must have made, I would think, in the synergy between doctor and patient, that would make it doubly tough.
Well, it is an obstacle in a sense, but I found that doing regressions or doing this work with a translator works pretty well, too. They hear things twice. So it's more... It doesn't seem to get in the way of the regression.
Okay.
It takes a little longer because you're working through the translator. But we were doing it, and I've been all over the world doing this in different languages, Spanish and Italian and Portuguese. So to do it in Japanese too. So here was Chinese, and she was an important woman in coming from Beijing, and as I said, a surgeon. And she remembered a lifetime during this regression in the San Francisco area of the U.S. about 1850. And in that life, she was having an argument with her husband. And she began to speak during the session in very colorful, fluent English.
Wow.
And this is that Xenoglossy thing, speaking foreign languages you've never learned. The translator didn't realize it at first because translators hear one language and they translate into the other. So he started translating the whole thing back into Chinese for me. And I had to hold up my hand and say, stop it. I understand the English. So
yes.
That kind of thing, because I knew, and he certainly knew, I thought he would fall out of his chair, the translator, that she couldn't speak English at all 30 minutes before this. And here she was speaking English fluently. So as a scientist, you have to say, what is this? How does this work? What is this all about? Another case is a woman that I started to mention before the break, Jenny Coquel, a British woman. I met her at first when she was 41 years old, and she was talking to her 85-year-old son and her 81-year-old daughter. And the story is from the time she was a little girl, and this is just like the past life cases of Ian Stevenson and others. She had known she had a family in Ireland. She was born in England, that she had 8 children. She's telling this to her parents when she's 3 years old, that her husband was irresponsible and she couldn't trust him to watch over the children because she had died and left them when she was young. She had 8 children. She died early. She needed to find her children. And she knew her name was Mary, but she didn't remember her last name. She drew some crude maps. She drew a church with an unusual facade. She drew a large white building with many windows. But not enough. The parents didn't believe in this. There wasn't enough data really to go on. Jenny grew up and got married, still with intrusive memories, dreams of this past life family in Ireland and her 8 children. She got out her maps. Now, she's an adult with 2 children of her own. she decided to do something about it. She compared her childhood maps with an atlas of Ireland, found a town, Malahide, northeast of Dublin, that looked like her maps, and decided to go there. So she's walking in the main street of the village, having deja vu feelings, and then she finds the church that she had drawn when she was a little girl, the church with the unusual facade. And she knew she was in the right place. But the house she felt she lived in was empty, in ruins since the 1950s. She felt she lived there in the 20s and 30s. But now with the help of the townspeople, they find that the family that lived there was the Sutton family. The mother's name was Mary Sutton. She died from complications of childbirth after the birth of her 8th child. So all these facts are coming true. In the large white building that Jenny had drawn when she was a little girl, that was the hospital in Dublin, and Jenny was able to go there, go to the very room and describe what happened. And the husband was irresponsible. Of the 8 children, they all grew up in orphanages, and 5 were still alive. So they open up the records. There's this big reunion. The youngest 2 didn't even know that they had siblings. They had grown up in different orphanages.
God.
And Jenny was able to tell them all about their childhoods, the little details that only their mother knew. And
wow.
when you come across cases like this, and you see it again and again,
yes,
these are very convincing.
They are very convincing. How far down line, I mean, the early stuff, and then how far down line do you think you made the flip when you suddenly, I mean, the light bulb went on and you said, okay, this is real?
Well, there were a couple parts for me, because I was so left-brained, still am, you know, all that. I had written over 40 scientific chapters in scientific journals like Nature, Brain Research Science. I had